nasal cavity. And if you ask a specialist, no one really knows why we need them, but they have developed a lot of theories and also a lot of labels for diseases associated with turbinates. Don't you like that our medical professionals, without really knowing what's happening in the body, they try to heal that and cure things? So turbinates, they live a cyclical life. Every 1 to 7 hours, one turbinate constricts while others swell up, and this makes some part of the nasal passageways narrow and restricting airflow, and while enlarging the other parts. So during these nasal cycle change, you will feel congested. You will not feel congested because your overall airway resistance is actually not changing, right? So it's constriction one part, but swelling up in others. So it's kind of a permanent, constant airflow. The purpose of that is unknown to the specialists and doctors. But as I said, they have a lot of theories. And I also mentioned that people who suffer from nasal congestion, they go to specialists, and sometimes a surgery is offered, and the surgery is to reduce a turbinate or to remove one or two altogether. And people who undergo those surgeries, they experience very particular symptoms after that. And the symptoms are normally to do with emotional and mental states. So people start experiencing anxiety, depression, and overall, their nasal congestion, their breathing does not improve much after those surgeries, interestingly enough. So what it tells us is that our structure of the nasal cavity not only provides the passageway, but it communicates with our brain, and it gives feedback about the volume of air, about the temperature of air.